Med-Surg nursing skills. Determining IV medication compatibility. Always use the IV manual in your facility. This generic example for nursing students will use the Davis Drug Guide for Nurses 17th edition. Now, I've found in my personal experience that some of the conclusions and findings of the Davis Drug Guide differ from those of the IV manual in the facility in which I work. It is imperative that you always go with the manual that is endorsed by the facility where you work. So that for me, if there's any discrepancy between Davis Drug Guide and the manual where I work, I'll go with the manual where I work. Potassium chloride and diamond hydronate. So let's say we had an order to hang some Gravol or diamond hydronate. Maybe it was a PRN order for nausea. And let's assume the patient's base solution, the primary bag, was potassium chloride. And that we want to hang the Gravol in a secondary bag. We need to check if these two are compatible. So using the Davis Drug Guide, we turn to potassium supplements, potassium chloride. We go to the section entitled Y Site Compatibility. And we look for diamond hydronate, which should be right around here, but it's not. That alone is enough to tell us that we cannot hang the Gravol with the potassium chloride. Because the diamond hydronate does not show up in the section that says Y site compatibility. Now, if we look further, we find a section that says Y site incompatibility. Interestingly enough, diamond hydronate is not in that section either. What this generally means is that the authors of this book and the studies they have looked at have been unable to determine whether or not diamond hydronate is compatible with potassium chloride. So they don't really know if diamond hydronate is compatible or incompatible with potassium chloride. From our point of view as nurses, that would be enough to say we can't hang these two meds together because it is not known whether it's compatible or incompatible. Now let's say we had a patient who had a PCA running and hydromorphone was in the PCA pump. And maybe they had normal saline in the primary bag to keep the vein open. And again, we had an order for diamond hydronate or Gravol for nausea. And so we know diamond hydronate is compatible with normal saline, but what we want to know is diamond hydronate compatible with hydromorphone? Because ultimately, whatever's running as a secondary bag will mix with the hydromorphone in the line of the PCA. Are these two meds compatible according to Davis Drug Guide? So we turn to the hydromorphone section. We go to the Y site compatibility section for that drug. And again, we don't find diamond hydrogenate. It should be right here. When we look at the Y-site incompatibility section, there it is, diamond hydrogenate. So this case differs from the first case we just looked at in that, in this case, we now know for sure, that diamond hydrogenate is incompatible with hydromorphone. So again, we wouldn't hang these two drugs together either. We often find potassium chloride running as a base solution to keep the vein open on a PCA, which may have hydromorphone in it. And so the question is hydromorphone and potassium chloride compatible? How would we check that in the Davis Drug Guide? Go to hydromorphone, go to Y-site compatibility, and look at that. There's potassium chloride in the Y-site compatibility section. So we know that potassium chloride is compatible with hydromorphone. So we can definitely run these two meds together in the IV. Again, I'd like to stress that some of the findings from Davis Drug Guide have differed from what the drug guide at the facility that I work at has recommended. Always go with the research and textbooks and drug monographs that are endorsed by your hospital or institution. The reason I use Davis Drug Guide in this video is because it's a very common guide in many nursing schools in my area. And so when we're not in the hospital, we do turn to this, at least as a way of practicing.